Frogner.
All right, so I'll go next. So I'll reflect on this from both a kind of professional point of view and from a personal point of view. I think what was so fun about being part of this committee was how incredibly diverse the group was. We came from a variety of professions, and I realized how few forums there are really for these different professions to come together and have this conversation. I sometimes don't appreciate how few opportunities there are like this because I came from the field of public health. That's where my training originally came from. And public health is a theme that came up many times, I think, in our conversations. And I realized that the field itself is, by definition, a very diverse field. We bring together professions of all different kinds. You have anthropologists, you have people who care about urban planning, you have people from the medical profession, nursing profession, all these different ones who come together. And on a daily basis, we were having these conversations in our educational environment. And I think people get excited about public health once they hear stories that just get them realizing that health goes beyond just what happens between you and a physician's visit. However, many people don't know what public health is. I remember when I first told my mother that I was not going to be a medical doctor anymore, I wanted to go into public health. And she said, "What is that? Is that social work?" I said, yeah, it could be in that. If you ask anyone what public health is, they would say everything. They will find health everywhere. And I think there needs to be more forums that get people together to have these kinds of discussions. However, even in the public health field, we are also culprit of getting siloed ourselves. Being a professor in an institution that tried to promote community practice, at the end of the day, publications counted, dollars that you bring in grants counted. Now, where I started my professional life, they did try to have promotion criteria that try to reward community engagement as like a fourth leg of the stool. So usually it's education, bringing in scholarship and or doing scholarship and bringing in funding, but the fourth leg was actually doing community engagement. I think so universities can put those kind of criteria in place. I think if you can also reward publishing on education, that would be great. Try and say, how can you give back to your own educational field and find ways to improve that and publish on it. That needs to be rewarded. And also, I realize funders can help direct the kinds of activities we do by saying in their RFAs, they want us to actually do something with the community. Now, from a personal side of things, I realize in that question of how do we know whether or not we've made some improvement around the social determinants of health, I look at my own personal experience as a first-generation kid of immigrant parents who came to America to live the American dream. My mother's from Japan and my father's from Norway. Pretty good, well-situated health systems, and I'm an only child. And I often wonder myself whether my parents made a good decision to be here in the United States as they get older, and whether I can say that they're going to age into a good system or not, especially given that my father came from Norway, my mother came from Japan, which have pretty solid health systems. So one marker for me is whether I will eventually feel that my parents will be well taken care of in this system. Another one are just little basic things. I have published on Medicare reimbursement, but I can't help my parents sign up for Medicare. And I'm not the only one in my field to say those types of statements. So one way for me to know that a marker of improvement is whether I feel like I need a PhD or not to actually navigate the health system. I think if I feel like you don't need a high level of education to navigate it, that might be improvement. And the other one is my mother has, even though she's been here for 40 years, has still quite a bit of broken English. And oftentimes she comes back from the doctor and asks me what she was prescribed. And sometimes I realize that the doctor just spoke too fast for her. And she even has a Japanese-American doctor, so you would think culturally they look the same, so that should be a match. But that's not enough. You need to go beyond just what someone looks like. You need to think about the language barrier, someone who has an appreciation for what it means to be an immigrant and the different kinds of respect and the dialogue that one has with their medical doctor if they are an immigrant. My mother, I think, thinks very highly of people in white coats. So put a nurse practitioner in a white coat, she'll think you're a doctor. But those kinds of little subtleties make a big difference in the relationship. And having some cultural awareness, like perhaps that Asian people tend to have more lactose intolerance, might be a conversation that should come up rather than immediately assume that that stomach problem she's having might be acid reflux. So little things like that, I think to me, I reflect on how the social determinants of health are integrated in healthcare, and I realize it's the little things that sometimes make a big difference. So that's my